Today, I want to talk about the mental health crisis affecting older adults and their families. Did you know by 2034, there will be more adults 65 and older than children under the age of 18? In fact, older adults are the fastest growing age group in the United States. There's a phenomenon that happens as we age. We actually become more resilient with time and life experience. And as we age, we're actually less likely to experience a mental health condition than people in younger years of life. Despite this, 20% of older adults will indeed experience a mental health condition like depression, anxiety, dementia, substance use disorders. Yet 67% of these folks do not receive adequate mental health care. When older adults don't receive mental health care, they experience worse medical problems. They experience more hospitalizations. They use more medications for their problems. They go to the ER more often. Their caregivers experience more stress, and their risk for suicide goes up. And this is important because older adults have the highest rates of suicide in the United States. And we can do something about it. Older adults actually benefit from mental health care at the same rates as younger adults, especially for depression. So why is this happening? Why aren't older adults getting the mental health care that they need? There are many factors contributing to this, but I'm going to focus on three. The first factor is lack of information about what's typical with aging and not typical with aging. It's not a normal part of aging for an older adult to have depression or dementia or to be tired and sleepy during the day. We have limited access to information about what's typical with aging and not typical with aging, especially when it comes to mental health care. 2, ageism. Ageism is bias and discrimination based on age, and it would have us believe that it's normal to be depressed with age, that dementia is normal when we get older, right? Wrong. Depression is not a normal part of aging. Dementia is not a normal part of aging. But if we think that they are normal parts of aging or typical with aging, well, your friends are dying. Of course you're depressed. Oh, you're forgetful. Of course you have dementia when you're old. Then we're not going to be picking up on the signs that our older loved ones or friends or colleagues or patients are experiencing a mental health condition that can be corrected and managed, or a dementia disorder that also needs to be assisted and managed and cared for. So if we believe that things are normal with aging, we're not going to be detecting when they're not normal with aging and getting people the care that they need. And this ageism contributes to the already high level of stigma that older adults and their families experience when it comes to mental health care. And 3, access. Older adults and their families struggle with finding access to mental health providers. So where do I even look for a mental health provider? Which provider do I actually need? It's so confusing. What's the difference between a therapist and a psychiatrist and a neuropsychologist? Where do I even begin? Access is a barrier, not only for families, but professionals too. How do I find a geriatric mental health provider in Hollywood, Florida? I don't know. Because there's not a clear pathway for helping older adults get access to mental health providers who are specially trained to care for them, it's going to be hard for older adults to engage in mental health care. Well, I aim to change this, and I hope that you will join me. I'm Dr. Regina Koepp. I'm a clinical geropsychologist and founder of the Center for Mental Health and Aging, your go-to place online for the mental health care of older adults. Our mission is to make it easier for older adults and their families to get the mental health care that they need by 1, providing access to information that you can trust. We want to bring education to you that's easy to understand and clear. We want you to be less alone in your experience of living with a mental health condition and know that there are excellent resources available to help you. And speaking of resources, number 3 is to improve access to mental health care by offering a nationwide provider directory of mental health providers who specialize with older adults. This is where you come in. This is where you can help. If you're a family, get educated. Just start learning. There are loads of free resources on our website. If you're a professional, if you're a therapist or psychiatrist or neuropsychologist and you specialize with older adults, let's work together to make it easier for families to get the mental health care that they need. You know how hard it is for people to find a mental health provider who actually specializes in older adults. We're like unicorns. We're hard to find and magical. All you have to do is head on over to www.mentalhealthandaging.com and claim your profile. It's that simple. You'll be on your way to helping us build the largest mental health and aging provider directory in the nation. Together, we'll elevate mental health care for older adults and their families so that we can reduce that number of 67% of people not getting the mental health care that they need. Let's bring it down to 0. But I can't do it by myself. I need your help. www.mentalhealthandaging.com. I'll see you over there.